morning. Our next question is from Emily. Yeah, I like that name. All right. Let's see. Hello, Dr. Ben. I have an impossible question with a really long explanation. Fine. Yeah. Questions about an argument I'm having with some friends where we're looking at the same numbers and coming to opposite conclusions. Yeah, you must be in America. That sounds very American. That is just what we are doing as a country right now. All right, let's see what they are. So, here in Indiana, based on some pretty solid data sources, oh, very good fossils in Indiana. Very, very lucky. Yeah, good choice of state to be from. Yeah. Um, Including random population tests. Testing for both active infections and antibodies. Great. That is smart. It looks like the case fatality rate is about 6%. So case fatality is like when you go into the hospital, what are your chances of coming out alive or dead? And so 6% chance of death in hospital. But the overall infection rate is more like 0.6%. So 0.6% out of all people who are infected will end up dying. So maybe 1 out of 10 people who's infected will be sick enough that they have to go to hospital, and then 6% of those are going to die. That's how it is, and that's actually pretty close to national averages, I would say. Across the U.S. Furthermore, more than 90% of the deaths have so far been among people over 60. That's a little high compared to other places, but not completely unreasonable. Yes, this does kill disproportionately far more people who are old. So, okay, here's the controversy. Several of Emily's friends are saying that there's a low statistical risk of death to young people. And so it's morally, oh my gosh, morally unjustifiable to interrupt normal childhood activities. Wow, yeah. Wow, is it morally justifiable to allow people to get a disease that, yeah, boy, yeah, that's, all right, I'm not buying that particular argument. I would say there's other outcomes besides death that you have to look at when you're making your calculation. So we know that in a lot of kids, they don't have very severe infections, but there is this sort of multifaceted inflammatory syndrome that's associated with COVID in kids. And one of the really common effects of that is that it does what appears to be permanent damage to their heart. They'll end up with an enlarged heart. It enlarges some of the blood vessels that connect up to the heart. And in a reasonable number of cases, it can cause aneurysms in there. Now, this is something that's not going to kill you right away, but it's definitely not one of those Friedrich Nietzsche things where it's going to make you stronger. Because aneurysm is like a sort of a ballooning and stretching of some part of one of your veins or arteries. And eventually the balloon pops. And at that point, it's quite often fatal. So there are a lot of effects that we don't fully understand yet, and we keep learning new things, but all the new things that we're learning about the virus are bad. They're just like new ways that it's bad for a longer period of time to people that are otherwise healthy. And there's the other argument that you can try is that where does that virus come from that infects the old people? So even an old person who is in a nursing home, let's say, still has some contact with the outside world because it's a nursing home and they have nurses in there and attendants, and they have people who come in and cook and bring in the food and people who clean. And sometimes nurses have to do most of that stuff. Maybe not the cooking, but maybe even that sometimes. I don't know. They do a lot of stuff. And all of those people are potentially going to have kids, and so if their kids are going to school, you're letting the virus in by the back door. I think that's something I've said before, but maybe I didn't explain it very well. What we want to do is reduce the total amount of virus in the world, and by allowing anybody, kids included, to go out and get together in a way that is going to spread the virus, it is going to lead to more cases. This is exactly what we've got. Memorial Day is 100% responsible for the surge of cases that the US is dealing with right now. And we're back up very near, or maybe even above, I'm not sure, but it went down, up and down, and it's right back up to the top again. um, uh, we're we're just about as bad, or maybe as bad as we were at the peak in the U.S. So we made some progress, and all of that progress, all those sacrifices, have been erased because kids, yeah, don't live on their own. Yeah, kids live in homes. Homes have working people. Working people have older relatives, or go to work with old people, or go to work at places where they can potentially pass the virus on. And so you can't be thinking in terms of, well, the kids aren't going to die, so let the kids get it, because the kids may die down the road because of this. And yeah, we've got to think in terms of how do we get rid of the virus. So this kind of thinking, like, if I'm not at risk, I can go and do whatever, or if you're not at risk, you go do whatever, and I'll wear a mask. This kind of thinking is exactly what sets America apart from the rest of the world that is controlling the virus. And this is the thinking that got us into this situation where we are right now. And it would be really nice to get out of this situation, but we're not going to do it by doing the same things we did last time, or that we're doing right now, because yeah, that's not working. That's terrible. So so there we go. That's my capsule answer. I gotta say, I am 100% on Team Emily, and yeah, I respect your friends' views, but they're wrong. Yeah. Thank you very much. This is Ask Dr. Ben.